How many meridians are there? You mentioned the lung meridian, the stomach meridian.
There are 14 main ones that traverse up and down the body, arms and legs and front and back. And then there are something that's called extraordinary meridians, and they tend to borrow points from the other pathways, and they kind of follow their own route, which is very asymmetrical.
How do you even decide which meridians are a problem or what organs are involved?
Well, that comes through our study, which is, that's where I guess the integration between Western medicine and Chinese medicine comes in, because we're all Westerners here studying the Chinese medicine, and we have people that come to us and say they have sinusitis and they have irritable bowel, and those, we have to know those things, and we also have to know, well, what could be involved? Is the liver? What part does the liver play in, say, the intestinal function or the immune system? That is, and is it more immune, or is it more that some things are too slow? And I mean, it gets even into, of course, we have to look at people's lifestyle too, whether they sit at a computer all the time or are they outdoors chopping wood. It makes a big difference.
Can you do harm with acupuncture if you accidentally have a misdiagnosis?
No, the worst that could happen is nothing.
So no effect whatsoever?
No.
So it's not like acupuncture can block a meridian or damage an organ or damage...
No, it cannot. And that is one of the really great things about it, is so safe and non-invasive.
Now let's talk about herbs, because my guess is those aren't quite as safe or non-invasive, because these are medications and some of them are quite potent, so they should not be taken lightly.
Right.
Tell me, what, for example, with sinusitis, what would you use as an herbal medication for sinusitis?
Well, these are all Chinese names, I'm sorry, I can't. They're combinations, all are formulas, oftentimes of 12, 14 different herbs, and they all work together. That's probably the most useful thing I can tell you about them.
So these aren't the herbs that we know about, like ginkgo biloba, and
no.
These are
These
really
are
medications.
Chinese herbs. These are from the Chinese Herbal Materia Medica, which is, it may have some of the same herbs as we're familiar in North America, but there are a lot of different ones, and they also have a different strength to them.
Why is it that now only licensed physicians can write prescriptions for medicine, but are Chinese herbs not regulated by law?
They are not quite regulated. The FDA is trying to regulate that, and that is where some of the problems of licensing and governing what goes on. And the best a person can do is to select someone who's been trained and trust their advice.
If these are eventually regulated by law, are you actually licensed, or will this be then you will not be able to prescribe or give these medications anymore if they do come under the FDA?
Well, it is still our professional organizations, I have to say, that they are working to show how this safe practice of herbal medicine with someone who is trained is something that we should have included with the practice of Chinese medicine. I'll say that acupuncture is acupuncture. Chinese medicine should include the practice of herbal medicine and acupuncture. That kind well-trained person in both of those can do the most good.
And they should, yeah, so that they should know how to work with both of those together.
Yes.
Let's talk a little bit more specifically about Chinese herbs, because people know some of these names now. Americans know some of these names. Okay. And talk a little bit about the more well-known Chinese herbs and how effective they are and what they do and what they can treat.
Okay. One very well-known one, dangui, in women's health. Now, in Chinese medicine, this is hardly ever used by itself. It is used oftentimes as a main herb in a woman's formula, because it's very good for the blood, depending on what part of the herb is used.
Now, when we're talking about a woman's formula, I mean, that's always a code for, what is it? We're talking about menstrual cramps? Are we talking about irregular menstruation?
All of it.
All of it. But how can you treat something so varied with the same thing?
But you don't treat it with the same thing, because if a woman has fibroids or cysts, then what you want to do is include an herb that will help dissolve or break that up.
Okay.
If a woman is chronically late with her menses, then you want to, kind of increase the yang energy.
And there are certain herbs then that are keyed to, because you had talked about how Chinese medicine looks at the entire world, not just at the person, not just at the disease. They look at the environment, they look at balance. Again, very foreign concepts and very difficult to understand for Westerners. I'm using the words, but I don't understand them.
That's okay. Yeah, what I often, it's really an education process too, and I think a lot of our patients enjoy that. They want to explore this world, so I usually recommend some books for people who want to go into the theories, and I do the best I can to describe. If they are so interested, other people, they may just want to have a relaxing session on the table and they won't talk very much.
Well, when you work with herbs, and you're saying, and you decide what the specific ailment is and what people actually need, how do you formulate the medication, or are they already pre-formulated?
I tend to use pre-formulated medications. They are, there are certain ones that are good, and I know, I know what things are going to help what. So I will usually use something that comes in a capsule or a tablet, because that's the most easy to take.
And where do you get these medications?
I get them from suppliers mainly on the West Coast, and they are very much complying with what the FDA is saying about safe practice of herbs. They're very much into what is going to help our practice. They're not in any adversarial position. They want to educate the public.
Are suppliers responsible? Do they only give the herbs to people who really have had thorough training, or can anyone call up one of these companies and say? They
are very fussy now that they have to have a copy of your license before they'll send you the herbs.
Interesting. Okay, you've mentioned then one specific herb that that you can use for women's reproductive system.
Yeah.
One other popular, well-known herb, let's say.
Astragalus.
And what is that used for?
People use that a lot for immune system, and they'll use it oftentimes as a single herb. However, in Chinese herbal medicine, it's usually used in a formula with a number of other herbs. And let me just say a word about the formulas that traditionally they looked at them as being like a family or like a community. And that's why there's a whole number of herbs, because one may be the main herb, and that might be considered the emperor or empress herb. And then the others will be helpers in some way, like the prime minister, the general, and general marshals, the troops. And there's also a movement concept with these herbs, that some of them will specifically target certain meridians, and some of them will cause the energy of the body to move upward, which you want for sinuses, and then you also want it to move down.
Thanks, Frances. This has been really interesting. Yeah. I want to thank Frances Gander for joining us to talk about Chinese medicine. For upcoming episodes, viewer feedback, and links to important information, log on to our website at the address that appears on your screen. Thanks for joining us on Health Vision, a production of WOUB Public Television.